What are floaters? Well, the vitreous jelly in the back of the eye is about 99% water and 1% little collagen fibrils and some globular proteins. And those structures early in life are very clear. As we get older, and it's not really an aging degeneration, I like to tell my patients, a lot of them say, well, is this because I'm getting old? I said, no, it's really an issue of exposure to time. There's a subtle difference there. Nonetheless, with time, these proteins start to clump together. And eventually, in 80% of us, the jelly peels away from the retina, from the back of the eye, and collapses in on itself and makes all these little clumps of gel. The light coming in the eye strikes that gel, it scatters the light, which casts a shadow on your retina in the back of the eye, which we then perceive as little black spots, bugs, worms, and those are the floaters. Most floaters are benign, although annoying. And some patients complain quite bitterly about their floaters. But most of them are benign. What we worry most about floaters and flashing lights is it can be associated with a retinal tear or retinal detachment. So anytime anybody has a new onset of a shower of floaters or flashing lights, it's imperative that they get in and get a good, full, dilated eye exam to check the retina to make sure that the retina is secure. Once you've figured out that the retina is secure and not going to detach, then it's an issue of how do we deal with this annoyance?
And what causes flashing lights?
Is basically the retina is a real big phototransducer. It has no pain fibers, cold fibers. So if you pull on the retina or do any kind of mechanical stimulation of the retina, it generates what we perceive as little flickers of light. And typically they're noted at bedtime or in dark environments, most commonly. They're probably going on throughout the day, but it's being bleached out by the ambient light. So the flashing lights indicate that there's some kind of mechanical stimulation of the retina. And typically when associated with floaters, it's the vitreous jelly that's peeling away and pulling gently on the surface of the retina. And again, as long as it doesn't pull a hole or a tear in the retina, it's not a medical problem per se. It's more of an annoyance. The flashing lights usually subside within a month or two. Floaters, if they're just benign floaters not associated with a tear in the retina, they generally get better. But over 6 months, 12 months, it's a very slow process. Most people eventually stop complaining about their floaters. Some of them dissolve. Some of them will drift over to a part of the retina where they don't notice it as much. And in some of it's just your brain gets used to it and learns to tolerate it.
Finally, we ask if there is any way to treat floaters in the eye.
Currently, there's really only one treatment for floaters if they're bothering the patient and interfering with the patient's ability to function and work, and it's surgery. So I usually discourage patients from proceeding down that path because surgery, although it's a very simple procedure, it's a vitrectomy surgery, going into the back of the eye and removing the jelly and the floaters. It's a fairly simple procedure. It's a 20-minute outpatient kind of thing. It is surgery, and it does have risk. So you don't really want to engage in that risk if it's not really necessary, in my opinion. As Mark Twain once said, there's no disease a doctor can't make worse. And to go in after floaters, you could be tickling the tail of the tiger a little bit. So I usually encourage my patients to give a new onset of floaters at least 6 months before they determine that they want to have surgery on them or not.
For more information on Dr. Kent Small and the Macula and Retina Institute, please call their Glendale office at 818-552-5040 or their office in Los Angeles at 310-659-2200. Or you can visit their website, maculaandretinainstitute.com.